as promised, because I did not get through this content in class, I don't want to just ignore it because it is very important. We left off and we were just getting ready to start with cleft lip and or palate. The picture that's on the screen is probably a little disturbing. I want you to envision what it would be like for brand new parents. And even though they've been told from the ultrasound that their child would have cleft lip or cleft palate, there's still a shock value. And you can anticipate that there's going to be grieving coming from the parents because their perception of the perfect child that's been promoted in diaper commercials, baby foods, toys, they've lost that. It doesn't mean that they're not going to be fantastic parents. They just need time to process that their child is not the perfect image of a child. So, cleft lip and or palate, and the reason I specify and or is that a child can have cleft lip, and along with it they can also have a cleft palate, which means that there's an opening. They have not fused. Or they can look perfect from the exterior and have an open palate as well. So cleft lip and palate occur in 1 in 1,000 Caucasian births, 1 in 500 in Native American births, and 1 in 2,000 in Asian births. Not real sure why. It's more common in Native American births, possibly. It is a congenital defect. Possibly it is because it's a smaller community and it's a much smaller gene pool. We'll leave it at that. Okay, so they don't really know what causes cleft palate or cleft lip. Most commonly, it's both. Just the cleft palate alone will occur in about 25,000 births, so it's not as common. But they're not a definite known cause. And as I already said, you need to support the parents. They have to go through a grieving process. Even if they were aware it was coming, it's a visual and it's shocking. A priority is to instruct about feeding and caring for the infant. This infant will most likely go home with them, and it'll be a while before constructive surgeries are performed. And as odd as it may seem, the child that's born with the intact lip but the cleft palate may have more serious problems. There will be more difficulties with speech, with surgeries, those kinds of things. So this is just a visual to understand. You have what would be a normal palate, and then what's considered a cleft palate. And then you have the visual for the left unilateral cleft lip and palate. Or you can see just the cleft lip. And then you'll see the bilateral where both nares are involved. So what's most important right off the bat? How do we prioritize? Well, first off, you need to make sure that they're going to be able to obtain nourishment. So you want to assess the newborn's ability to feed. There may be some changes that have to be made to assist them. So breastfeeding is encouraged, just as it is with any newborn. Breastfeeding is encouraged. You just want to make sure that they're able to latch. If mom is having difficulty latching, then you would encourage her to pump after attempts have been made to breastfeed. And it doesn't mean that she shouldn't try to go back to breastfeeding. As the baby gets stronger and more adept at nursing, the baby may be able to latch. After breastfeeding is set aside, then there are special nipples. There's different feeders. One such thing is called a Haberman nipple, a Haberman bottle. And one of the things about these nipples is they're very soft and they're very easy flow. It doesn't require a lot of energy or a lot of suction on the newborn's part to get milk to flow. And if the baby is just not able to latch on to the breast or one of the special nipples, then it is possible to go ahead and do a syringe with a soft tubing, and you can feed them that way. No matter which method you use, definitely frequent burping, because they do have openings. There's going to be more air swallowing, so definitely a lot more burping throughout. And educate the parents. And educate the parents that nothing they're going to do is going to hurt the baby. How to recognize for signs of aspiration or signs of dehydration if they're not getting enough, but educate them. You also want to really promote bonding, lots of holding. Like I said, stress, they're not going to hurt the baby. Baby's had 9 months of his body growing with the cleft palate and lip. It's not going to be sore or painful to the baby, so they should really hold baby, bond with baby, move forward as if baby had no complications. So time of repair for cleft palate, you'll find several different schools of thought as to when the time of repair is to be performed. There's a school that says it should be done after birth, before discharge, to reduce scarring and that such. Cleft palates are typically done in stages, and it's important that they be done before speech formation. Because if you're speaking, say a few words to yourself, nobody will know. You put your tongue to the top of your mouth. The palate is important for speech. So 9 to 15 months, 9 to 18 months at the absolute latest, because they are starting to take in vocabulary and form words rather rapidly after 15 months. So after they've had surgery for repair, the baby will come back and will be placed in elbow restraint. So their arms are going to be straight. They may be sticking out straight like a T, or they may be sticking straight down. They should be placed on their back or their side after surgery. Never place them on their abdomen. So in this case, tummy time, while it is important, not while they're fresh out of surgery. You don't want to take the chance on them damaging the suture lines. You don't want to allow sucking. And you want to try to keep them very calm and very mellow. You don't want a lot of crying. In this instance, they'll do syringe feedings until they're healed up, or they may use a cup, but again, no sucking. And then this next one is one of the most difficult that the families have, and I've seen nursing staff have difficulty with this as well. You really want to encourage bonding and cuddling with the caregivers. They're not going to hurt them. Let them hold the baby. If you want to keep the baby calm, mellow, and trying not to cry, best bet is to let mom or dad or grandma or grandpa hold the baby. Again, the restraints must stay on, but there's nothing that prevents them from holding the baby. Okay? All right. We're going to pause, and I'm going to run this as a separate video, okay?